Welcome back to the deep dive. Today we're looking into something pretty huge that happened back in 2021. Oracle buying Cerner. It was a $28.3 billion deal, and it's still shaking things up in healthcare tech, even now.
Yeah, it really is. It's a big sign of where things are heading when a company like Oracle, puts down that kind of money. They're definitely seeing a future where healthcare is all digital.
Right, absolutely. Now, some of our listeners may not know Cerner that well, but they're a really big name in health IT. Mostly they do electronic health records, EHRs.
Yeah, basically it's the move from like paper charts to a whole digital system for all your health info,
Yeah.
medical history, test results, all
Yeah,
digital.
your whole medical life,
Right,
basically.
and EHRs are like the core of healthcare these days. They affect how doctors diagnose things, how hospitals run, the whole picture. So Oracle, this giant in cloud computing and databases, them buying a company like Cerner, that's huge. I mean, it could really change things, even for patients.
Okay, so let's get into it. What we want to do today is figure out why Oracle, a company known for databases and the cloud, went and spent billions on Cerner. And what does it mean for how healthcare works, how our data gets managed, all that, down the line. What we're looking at today is this cognitive market research blog post. It came out in February 2025.
So we've got a few years of hindsight, right? We can see what they were thinking back then and how things have actually played out.
Right, exactly. So, first things first. Why did Oracle buy Cerner? What was the thinking behind it?
Well, the blog post makes it clear. Oracle wanted in on the whole digital transformation happening in healthcare. A lot of industries are going digital, sure. But healthcare, with all its data, all that sensitive information, that's where the big changes can happen. And Oracle saw that.
Yeah, we see it everywhere, right? Hospitals, clinics, even individual doctors are using the cloud more and more. And it
Yeah.
makes sense. I mean, potentially. It could make everything more efficient and hopefully a smoother experience for patients.
Yeah, exactly. And for Oracle, Cerner was the chance to grow their cloud business big time. Specifically, their Oracle Cloud Infrastructure, or OCI. The amount of data Cerner's systems handle every day is just massive. And to manage all that data securely and efficiently, you need serious cloud power. Like imagine a doctor in the ER needing to see a patient's whole medical history right away. That's the kind of situation that's driving this need for powerful cloud solutions in healthcare.
And that's where Oracle's expertise comes in. They know databases, they know the cloud, and it's not just storing the data, right? It's about making sure it's organized, it's secure, and doctors can access it whenever they need it. The blog post talks about using AI, artificial intelligence, to analyze data, automate things, and process information instantly. That could be a game changer.
Right, it's huge. Like imagine using AI to track patient data and spot health trends in a community. Or using it to automate, say, those prior authorizations for medical procedures. That would free up staff to actually help patients. It's about making things more efficient, getting insights from the data.
There's also the issue of interoperability, which, it comes up all the time in healthcare. It's a real problem when different healthcare systems can't share information easily. It gets in the way of good, coordinated care. So, how did this acquisition try to tackle that?
Here's what's interesting. Oracle's idea was to create a more connected healthcare system, basically. By linking Cerner's EHR system with their cloud and AI, they wanted to break down those walls that stop data from flowing between different providers. So, say you go see a specialist, right? They could pull up your primary care records instantly, no matter what system each doctor uses. That's the hope, anyway. And if that works, you get better diagnoses, fewer mistakes, and better care for you.
So, it's not just about making one system better, it's about getting all these different systems talking to each other,
Right.
sharing crucial information. That would be a fundamental shift if they can pull it off.
It's a huge goal, for sure, but the potential benefits are huge, too. And the cognitive market research piece also, it points out the competition. Oracle isn't the only one who sees the opportunity in healthcare tech. Microsoft, Amazon, Google, they're all investing heavily. So this acquisition puts Oracle right in the mix. They're a real contender now.
Right. It's like a race to innovate in healthcare with these big tech companies all bringing their strengths to the table. But let's step back a bit. How did Oracle even decide that buying Cerner was the right move? The blog post mentions market research. What role did that play?
All right, you don't just drop billions of dollars without doing your homework, especially an investment this big. Market research probably showed Oracle how fast the healthcare IT sector was growing, how it was changing, and what it needed. They'd be looking at trends, seeing the clear move towards digital healthcare.
And the article gives some really interesting numbers. The market for electronic health records was already growing a lot, And they predicted the healthcare cloud computing market would be worth over $90 billion by the mid-2020s. Those are big numbers. That's a huge opportunity.
Exactly. Growth like that shows there's a lasting demand for the kind of integrated solutions that Oracle and Cerner, together, they could provide. Oracle's research probably found that people were getting frustrated with the old EHR systems. Maybe they had problems with data, or they weren't good at analyzing information. Maybe they were hard to use. And that created an opening for a new cloud-based solution.
And you can't forget about AI, right? Artificial intelligence. The potential there is massive. Think about it.
What?
More accurate diagnoses, personalized treatment plans, even streamlining all that paperwork.
Right, so this brings up a good point. What did Oracle see in Cerner specifically? Well, Cerner was already a big name in healthcare. They had relationships with hospitals, their systems were being used everywhere, and Oracle had the cutting-edge stuff. AI, machine learning, big data analytics. The market research probably showed how combining those two, those strengths could create something really powerful.
The blog post also talks about regulations, how healthcare organizations are being pushed to share data better. It wasn't just a good idea anymore, it was becoming a requirement.
That's really important. When the government steps in, that can really drive innovation. And Oracle, with all their resources and tech know-how, they probably saw a chance to build solutions that not only met these new rules, but were even better than what everyone else was doing. A way to stand out, by being able to share data smoothly and securely.
And let's not forget the money involved, right? Healthcare is a huge part of the global economy. It's a big slice of the global GDP. That kind of financial incentive had to factor into Oracle's thinking.
Of course. For a company like Oracle, getting into a sector as big as healthcare with that much potential for growth, it just makes good business sense. It fits with their strategy of taking their cloud business beyond just traditional software into specialized areas with tons of data.
So basically, the market research showed Oracle a really clear picture. A huge industry, changing fast, with problems around data and interoperability and a growing need for AI solutions. All this happening in a tightly regulated environment with a ton of money at stake. That's a pretty strong case for a big acquisition.
Yeah, no doubt. The research gave them the evidence and the projections to back up their plan to get into healthcare tech in a big way.
So when news of this deal broke, what did people think? Like within healthcare itself and among the analysts who watch this kind of stuff?
Well, the cognitive market research piece, it says there was a lot of buzz, which makes sense, right? It was a huge deal, and Oracle's a big name. Most analysts thought it was a smart move for Oracle, a way to boost their cloud business and maybe push healthcare tech forward.
Okay. And what about the hospitals, clinics, the places actually using Cerner systems? What did they think?
There was some cautious optimism, A lot of healthcare organizations were hoping that Oracle, with all their tech expertise, could make Cerner's systems better. Maybe they'd run faster, handle more data, be easier to use for doctors and nurses. Imagine a system that's not just powerful, but actually helps them do their jobs better, smoother workflows. That was the hope.
But something this big, dealing with the health data of millions of people, that had to raise some red flags too, right? Were there concerns?
Of course. Data security, that was the big one. Everyone was worried about that. And making sure they followed all the rules, like IDAPA in the US and GDPR in Europe. Healthcare data is very sensitive, very protected. So linking Cerner systems with Oracle's cloud, that meant they had to prove they could keep that data safe and follow all the regulations.
And this kind of deal, it doesn't just happen, right? There are regulatory hurdles. The FTC in the US, the European Commission, they had to sign off on it. What were they looking at? What were their concerns?
Well, they're mainly focused on competition. They want to make sure a big acquisition like this doesn't kill innovation or limit choices for people who need those services. In this case, it's the healthcare providers using these tech solutions. There were definitely questions, but the blog post says the deal eventually got approved.
So what helped it get approved? I mean, it was a huge deal.
Well, the fact that there were other big players in the market, like Epic Systems, Allscripts, MedTech, they still had a lot of customers, so it wasn't like Oracle was going to dominate the whole industry. The regulators probably felt there was enough competition to keep things fair.
So they got past the regulators, the deal went through. What did Oracle do next? And what's happening now, a few years later?
Well, the cognitive market research piece outlined some of Oracle's priorities. They focused on integrating Cerner into Oracle, of course. But a big thing was moving Cerner systems to the Oracle Cloud. Like we talked about before, they wanted to make those systems faster, more reliable, and cheaper to run. And to process all that data, they needed the power of the cloud. It's like they upgraded the whole infrastructure to handle a much bigger flow of information.
Yeah, it makes sense. They used their strength in cloud computing to improve what they just bought. And the article also mentions new healthcare apps powered by AI. What kind of apps are we talking about?
There's a lot of potential. AI could help with diagnoses, make them more accurate and faster. It could automate all those routine tasks that take up so much of a doctor's time. And they could use AI to predict things, like which patients are at risk for certain conditions or what the healthcare needs of a whole community might be in the future.
So it's not just about keeping records digitally anymore, it's about using that data to actually deliver better care, make the whole system more efficient.
That's the idea. And this acquisition, it made Oracle a major player in healthcare tech. It opened doors for them to work with hospitals, big healthcare systems, even governments who want to modernize and use the power of the cloud and AI.
So all that investment in AI and machine learning, it's about making all that healthcare data useful, giving doctors and administrators real insights they can act on.
Exactly. Give them the information they need to make better decisions, improve how healthcare works, and ultimately help patients get better care.
The blog post also talks about a bigger trend. This acquisition seems to be part of it, this merging of big tech and healthcare.
Oh yeah, definitely. Oracle isn't alone.
Yeah.
A lot of tech companies are seeing the potential in healthcare, seeing that it needs innovation. They're investing, and it shows that they're starting to understand the opportunities in this area.
So looking ahead, what kind of changes in digital health could this acquisition help bring about?
The cognitive market research piece mentions telemedicine, seeing your doctor remotely. That's becoming more and more important. Also, better ways to monitor patients remotely, manage their health proactively, and personalized medicine, where treatments are tailored to your specific genes and health history. And for all of that to work, you need robust data management and powerful analytics. That's where Oracle comes in.
It seems like this acquisition really highlights how important the cloud is becoming for healthcare. It's the foundation for so much, and maybe it's an example for other tech companies thinking of getting into healthcare.
It could be. What happens with Oracle and Cerner, their successes and their struggles, it'll be a lesson for other companies, especially those thinking of entering the healthcare IT market.
So the big picture is combining Cerner's knowledge of healthcare with Oracle's cloud and AI, we should start seeing improvements in how healthcare data is handled, how different systems talk to each other, and hopefully that means better, more efficient care for patients.
That's the goal.
Yeah.
It's not going to be easy merging two big, complex organizations like this, but it has the potential to really change healthcare for the better.
This has been a really interesting look at a major turning point in healthcare tech. Oracle spending $28.3 billion to buy Cerner. It shows how important digital transformation is in healthcare, how much we need better solutions for the cloud and AI. We talked about how market research led to this decision, how they saw the need for better data management, better interoperability, and the power of using data to improve medicine. The regulators had their say, but the deal went through. And now we're seeing the impact as Oracle brings its tech power to Cerner's place in healthcare.
And like we've been saying, bringing these two companies together, it's a long process. It'll keep evolving. We'll see the full effects over the next few years.
Exactly. So here's something for you to think about, our listener. As Oracle combines its technology with your health records, what does that mean for the future of healthcare? Will it become more personalized, more connected? And what questions should you be asking about how your data is being used, how secure it is, how accessible it is as healthcare goes digital? These are important things to think about as technology changes how we get care. Thanks for joining us on The Deep Dive.